Good morning, everyone. Thank you for joining us. I'm Victoria Rogers with the Greater Scranton Chamber of Commerce. Today we have a very exciting panel. We have a regional healthcare seminar with a bunch of our healthcare partners, and we appreciate their time today. It's an exciting discussion that I think we'll have and share with everyone. I just want to welcome Dr. Patrick Conaboy with Commonwealth Health. We also have Stephanie Grabowski with Geisinger and Margot Absansi. I knew I was going to mess this up, Margot.
That's okay.
Absansnik with Delta. Yes, I knew I got it before, and then all of a sudden this happened.
You did?
With Delta Medix. Thank you so much. We also have our partnering chambers too. We have Northern Pocono, Greater Carbondale, Greater Hazelton, Greater Pittston, Greater Wyoming Valley, Pike, Wyoming County. So thank you all so much. So I just want to throw it out there. Any of you can start. We're going to talk about basically going back into society and work life, kind of on the tail end of the pandemic. Oh, and Erin McFadden is with us too. Hey, Erin, good morning.
Good morning. Good morning, everyone.
Hi, Erin.
Is with the Wright Center. So now we have our full panel here. So again, open forum for healthcare specialists here. We have some really great different views and opinions, and so I welcome anyone to start. Margot,
So I'm hearing a great silence. We kind of lost it there
I know.
for a moment. I guess I can go ahead and start. Again, what we're talking about is getting back to life. At this point, I think we're lucky if we just look at Lackawanna County. Lackawanna County itself is in excellent shape. This morning, I saw our infection rate in the county is about 3.6%, which is astounding considering just a few months ago, we were at about 15% of the average people walking down the street were positive for COVID. This is the lowest that we have been in well over a year. Hospitalizations have declined greatly. The measure that we look at, the reproductive rate, is now below 0.5, which means that the pandemic is tapering off. We've had threats from the Indian variant of this disease, the British variant, the Brazil variant, South African variant. But so far, the vaccines have developed a really good wall for us, and they are proving to be successful, even in preventing the variants from becoming common in the United States to this point. So the vaccine percentage in Lackawanna County is now well over 50%, much higher than that in the older population. The vaccine rate is falling a little bit as we've gotten through everybody who really wanted it. Now we're up against trying to convince people to get it done. But in general, I think we're seeing a safer community than we have seen in a year and a half. It's not perfect and people still have to be careful and safe, but it is okay to go back somewhat to your life, especially if you've been vaccinated. And that's what the CDC has put out. People keep saying the CDC direction was confusing. I didn't think it was confusing at all. It basically said the vaccines have proven themselves to be very effective, and that if you have been vaccinated with some very simple extra steps to keep yourself safe, you can really go back to a lot of what your normal life was. You can go back to restaurants. You can go back to being around people. You can gather indoors and outdoors. Yes, when you're in a crowded place, still wear a mask when you're moving around, and still use a hand sanitizer or wash your hands. But other than that, you're okay. The vaccines are holding. If you haven't been vaccinated, yeah, even that 3.5% or 4% of people who are carrying the infection out there are a risk to you. And so you should keep wearing a mask. You should keep avoiding crowds. You should try to be with people mainly in an outdoor setting, but mostly you should consider getting a vaccine. That's probably the best thing if you can possibly do for yourself at this point. There are some trivial, very small numbers of people who have had true complications from the vaccines. In general, most of what you hear, and it's not even worth me repeating any of them, are misinformation. I think the other big thing about getting back is we have to let people come back at, especially if you're running an office or doing something else, recognizing that people have been holed up for over a year. There's a lot of anxiety, and it's not just about COVID. It's about being near people and being around people, and that's bringing up a lot of anxiety. So we are encouraging people to, yes, have in-person meetings, but give people a chance to attend virtually also. Let people enter society again at their own rate and in their own way, and that's going to take some time. And on the flip side of that, as I was telling my staff at all of our safety meetings this morning, this is our first sort of coming out of COVID holiday weekend. It's important to remind people not to use all that pent up energy all at one time. So keeping an eye on COVID safety, but also thinking about alcohol safety, sun safety, and all those other things about driving, etc. Put your toe in the water and get back into society slowly. We don't need explosions of partying like we saw in some of the southern states at various points during the year. So it's safe, especially if you've been vaccinated, to be together, to work in an office, etc. If I was in an office outside of the folks in my small room where we work together, if we know each other and we know what our vaccine status is, it's okay to take off the masks. If I was walking around a building or interacting, especially if you're not vaccinated, I would still wear that mask, and everybody in crowd should still wear it. And please wash your hands or use hand sanitizer. That's my entire dissertation. Thanks.
I think what I could add to that is that, one of the things that Dr. Conaboy brought up was, that the CDC is right in what they're advising people, that masks, maybe are not needed for those that have been vaccinated. The vaccine is obviously working. It's safe. More people should get it. But one thing I would bring to everybody's attention is, if you look back maybe 6 months prior to now, maybe even 8 months prior to now, I don't think we thought we would be where we're at today as quickly. We didn't think the vaccine was going to be available to the general public. Back in January, we didn't think we were going to have enough vaccine to be available to anyone who wanted one this early, but it's happened. So I think that's an important message to get out there too, is that we haven't rushed anything. It just so happens that we manufactured quicker. People got vaccine quicker. Luckily, our providers got the vaccine out to anyone who wanted it fast, and we were able to offer it to everyone who wanted it. And now, as he stated, we have kind of this vaccine hesitancy going on. We want to combat that and have more people get vaccinated, especially as the summer months, prepare ourselves for the fall, prepare ourselves for flu season, which is obviously seasonal. It's going to come up in the fall. We're going to need to get vaccinated for that, as we do every year as well. But we just need to keep up this momentum over the summer months as we're relaxing other restrictions.
Stephanie, I'll second that. I think one of the largest barriers that I'm seeing in the outpatient setting is fear, inappropriate fear of vaccination right now. And it's just misinformation. I think one of our biggest barriers that we're going to have to take on as healthcare providers, educating the public that these vaccinations are safe. It's so hard to rid people of these false beliefs that they are exposed to every day on the news, media, social media. And I hear everything under the sun as to why this vaccine is not safe, and I've yet to hear anything valid. And I think there's an abundance of literature out there, as you had alluded to, Dr. Conaboy. There are an insignificant number of adverse events related to vaccination. So I think we will continue to improve as a community as we can educate those individuals who have this false belief that the vaccine is going to harm them in some way. I can't imagine, When they created a vaccine to smallpox and polio, I don't think anyone ever questioned, oh, what is the efficacy? Is this safe? I think they were so grateful. They knew someone who was permanently paralyzed from polio. They knew people who died of smallpox. They were ecstatic to think they would not have to suffer the same disease process. And society has changed so much. So that in our clinic, that's our biggest barrier right now. It's just education.
And we're actually getting out there. The vaccine's not new. mRNA technology isn't new. It's been around since the 90s. It just hasn't been used widely in a vaccine like this before. But that's not to say that this won't be the future of vaccines. And I think it probably will, especially as more information gets out around the two scientists that from Penn Medicine actually that developed this mRNA technology. I believe they're up for a Nobel Prize in 2021, and it's kind of a fascinating story.
Margot, do you have your 2 cents? We'd love to hear.
No, I couldn't agree more with what everyone is saying. I mean, I think it's our responsibility, as Erin says, to get out into the community and educate. And that is what we're doing. And I will put a plug in for Lackawanna County. I've got to say, Lackawanna County is doing a phenomenal job in terms of community events, community education programs. And we have partnered with Commonwealth Health Ambulance through Lackawanna County to vaccinate all the homebound in Lackawanna County. And we have so far vaccinated hundreds of homebound. So between Delta Medix and Commonwealth Health Ambulance, I mean, we literally go through the entire county vaccinating the homebound, and all they really have to do is call 211. You pick up the phone, you call 211, which is the county. The county gets the word to us. We work with Commonwealth. These people are vaccinated. So we are even making inroads in the homebound population. I think what's left truly is the education piece. And that's what we all have to focus on, is helping people understand and not just be told they have to have the vaccine, but understand why this vaccine works and how it works and how they are helping each other and not just themselves. So I couldn't agree more with what's been stated.
Can I throw in one more point? I think everybody who has talked so far would agree with this. I know we're talking specifically, this is the chamber, and we're talking about getting back to work, getting back to society. But the other thing I think a lot of us are concerned about is getting people back to their health care. There is so much preventive medicine that hasn't happened. There are people who have delayed life-saving surgeries and biopsies and routine health care due to COVID. And you know what, to a great extent, that was the right thing to do months ago. Now it's time to get it done. It's time to get back taking care of yourself and taking care of your health care. Get that procedure done, get that lab test done, get that mammogram done, the colonoscopy. That's a message that we are trying to get out there, that the time to delay is over. It's time to get back and get yourself taken care of.
Pat, I'm gonna hop in here because that was the perfect segue. When Victoria asked us to prepare, my whole focus is going to be on a return to screening. So I'm going to throw some numbers out to this group because as employers, this is something that you should impart on your employees. There is a return to screening national program underway, and it's a collaborative effort between the American College of Surgeons Commission on Cancer, which we are all a part of, and the American Cancer Society. And I'm going to throw some numbers out to back up what Pat is saying. The American Cancer Society put out some statistics. So they're saying 43% of patients have missed the routine preventative appointments due to COVID. 35% of Americans had a cancer screening scheduled during the pandemic and missed it. and they've estimated that 22 million cancer screenings were canceled between March and June. So they ran a study which showed that at the initial peak of the pandemic, which was in April, screenings for breast, colon, prostate, and lung cancers were reduced by 85% for breast, 75% for colon, 74% for prostate, and 56% for lung. So screenings save lives. The American College of Surgeons Commission on Cancer did a study, and they're estimating that due to the missed screenings during the pandemic, we will see a 40% rise in late stage diagnosis of cancers. So I would like to throw out this program. It's a return to screening program, and basically they're trying, the American College of Surgeons and the American Cancer Society have calculated gaps in screening. So we have calculated our own gaps, and that would be in the Commonwealth Health cancer program. And we're responsible now to not only screen the number of people that we screened in 2019, but increase our screenings for breast, lung, colon cancer. And when you particularly look at things like lung cancer, we have been hugely successful with the low dose lung cancer screening in diagnosing lung cancer in the early stage of cancer where it is curable, as opposed to the late stage where there's a 95% mortality rate. So I'm asking the businesses to participate in this return to screening program, and there will be all kinds of information. It starts June 1st. There will be all kinds of information put out there, and hopefully we can employ the chamber to assist us in getting this information out to businesses so that their employees understand the value of the return to screening.
That's actually another great segue into our first question. Where can employers get tools to help deliver these messages? You know, to let people know that it's safe to go back and get your screenings and go back to your doctor for your annual checkups.
And I would steer them to the American Cancer Society website with a return to screening. And then I would also have them be on the lookout, because we all are, as healthcare providers, whether it's Commonwealth, whether it's Delta, whether it's Geisinger, whether it's the Wright Center, we will all be encouraging a return to screening. So on all of our websites, you should be able to find that information.
Great, thank you. Yeah, and if you want to send anything our way, we can absolutely try to
Absolutely
get the word out.
And Victoria, to kind of add on to what we're just talking about. So, you know, on our website, the Geisinger website, we talk about safety and how our patients can safely continue to receive care. But I think one of the things that healthcare certainly has experienced this past year, and certainly businesses have as well. And we hope that businesses are going to continue some of the things that they've learned as we are in healthcare. You know, our patients have wanted to receive healthcare differently this past year. They wanted to receive it via telemedicine. They wanted to receive it on kind of their own terms when they're ready. And I think that there's an amount of that needs to continue for patients, because we don't know when people are going to feel safe getting healthcare. So we know that screening obviously is really important, and people need to get back in and get those screenings done. But there's other types of healthcare too that can be delivered remotely, can be delivered via telemedicine, don't require an in-person visit. So that's certainly something at Geisinger that we're focusing on a lot, is to continually enhance our telemedicine services to our patients. It's going to help with things like ease of access for patients. You know, if you typically had to wait a couple of weeks to see a specialist, perhaps we can get you in to see a telemedicine specialist first in that area and at least get a consult and you know, all those different things. And I think the same holds true for businesses. You know, think about all the ways that they had to pivot to deliver services to their customers the past year. You know, I guess we could take restaurants, for instance. Restaurants had to do takeout. And a lot of restaurants that typically didn't do family style meals started packaging family style takeout meals. And maybe that's not what they normally do, but it's probably something that they shouldn't necessarily stop doing. If they have the ability to continue to offer some of those services, if there are, you know, patrons that don't yet feel comfortable going into a restaurant, they can continue to service then all of their customers, much like we are in healthcare. We're open, we're ready to see patients, but we also have other services for those who are hesitant.
That's great.
First of
I
all,
actually,
take out cocktails. I think that should continue there. But I do think it probably could use a little more work on getting offices, literature and support systems for how to bring people back in. So I said, I do think there's a lot of anxiety. I do think there's a lot of confusion on that. Can I sit next to somebody in this tiny office? What's the threat to me? How can offices make themselves healthier? I do think that we probably need to put a little more work into that and giving employers the tools. I have a couple days off coming up. I'll have to put some thought into that because I do think that people need that help, especially in our older buildings and our structures really have not been all that safe. We were talking earlier about why didn't healthcare providers always wear masks? That makes absolute sense that, we should have always been doing it. If you look at some of the cultures, the Asian cultures, mask wearing is very common and has been for quite some time. Sometimes it was for pollution, but it's also considered polite that if you have a cold, you'll wear a mask to protect the people around you. I do think that some of those cultural changes are going to have to take place in our own lives. Again, when you talk about restaurants or somebody in 6 years as a checkout person, handling everybody's stuff and they're 2 feet away from you, I think we're going to have to learn to make some accommodations for people. And I think it's perfectly reasonable for employers to say to their employees, what can I do to make you feel safe coming back into this environment? If you're a waitress or somebody who's bussing, maybe the gloves and the mask stay. And I think some of those things are conversations, and they're a combination of science and humanity. Coming back into a large office, I think those are conversations employers have to have with their employees. What does it take to make you feel that you are safe, that you can come in here and not have to fight with the woman in the desk next to you because she's back to not wearing a mask and hacking and coughing all the time, etc. So I think every environment is different, but I do think that we probably need to put more time and thought into that.
Because if you don't mind, certainly not kind of the healthcare profession side of it, but right back to Dr. Conboy's point, I think that's some of the tools that employers are looking for. And maybe that's a great place for us to step in, Victoria, is to start creating some kits to help deliver that message. Because even when I'm looking at the websites now as we're talking, the information is there, but I don't know that it's in this easy to deliver message that an employer can take and deliver very quickly. And I think the confidence level of our employers trying to take this information, decipher it, and then share it. Also, I think there's a little bit of a misstep there because they're not necessarily confident in reiterating the information that's being shared to them. So maybe we can find a way to put some toolkits together that can make some of that communication a little bit cleaner and easier for our employers.
that's great.
I think we have opportunity as we continue to offer vaccination to the general public. This is an excellent forum when people are willing to come and get vaccinated to educate them on returning to their primary care physician, seeking generalized screening. I know people do continue to do outreaches to the general public, and this is just a great place to capture them. I know the chamber had hosted the block party not that long ago, and we set up a table there just to encourage and educate people. You need to return to healthcare. Dr. Conboy, you had alluded to mental health, anxiety, depression. Stephanie, you alluded to telehealth. We need to find a way to reach these individuals who are suffering from severe anxiety and depression after being cooped up for an entire year. Individuals who did not suffer from this in the past, to help them feel comfortable and, reincorporate themselves back into normal everyday society. I think that's going to be a huge barrier.
I just want to touch real quick on, we talked about Lackawanna County and the vaccines. We actually just partnered with them. It just got actually posted on our website yesterday. We're basically doing for members on-site COVID-19 vaccines. So they will actually come to your office and distribute vaccines, which I know you all are saying it's super important, especially getting back to work life. And Dr. Conaboy has a good point. I all of a sudden have allergies and I sneeze a lot. So it's always like you turn and think someone is going to infect someone else. So maybe that's scary, and I know for the past year, it's like something that everyone gets nervous about in public. So, but I just want to throw that out there that we, Lackawanna County, Margot, you're right. And everyone agreed, we are trying to do the best we can to help and, whatever we can do to help you too. That's healthcare. Please let us know. I think we could be good partners. And Michelle has a great idea too, just to educate our members and the businesses how to get back to some sort of normalcy, how to make everyone feel comfortable with that. Going back to doctors' visits, like I absolutely agree with everything. We did have a comment from Renee. She said, our employers are comfortable coming into the office. Our question revolves around allowing the public back into our facility, coming into in-person programs. That's a great question.
So I'll start on that one. I think, our advice, and we're struggling with the same thing. We have a lot of activities, obviously, at Geisinger. We bring people into our buildings. Our employees want to gather. They want to see each other again. They want to hold meetings in person, things like that. And we're weighing all those options. But I think it's also about allowing people to be comfortable with what they're comfortable with. You have, I think it was Dr. Conaboy before who said, you have to have that option for people to be able to remain virtual if that's what they feel like doing for meetings and things, but also start to gather people together. Especially if they're vaccinated, let them trust in that vaccine. They can be together. Obviously in healthcare, we're still masked because that's part of the mandate. But I think that's acceptable. And I think for businesses, the same holds true. I've walked into businesses in this past week since the mask mandate was lifted, and I've seen in the same business, some people masked workers and some not masked. I've seen, going into some of the grocery stores, some of the patrons masked and some unmasked. It's really all about your comfort level. So I think we just have to be patient with people. I think businesses have to be patient with their staff and also their customers. But I think probably the biggest thing is we have to respect each other. There's a lot of anxiety out there. I think if you see someone who's unmasked, there's two trains of thoughts. Number one is they must be vaccinated, or there is some distrust for people that are unmasked probably as well. If you're unmasked, are you possibly one that didn't want to get vaccinated or don't like to mask? So I think we just have to also learn to trust each other.
Yeah, and I think it's going to be important for, again, employers to give their employees, as the public comes back in, that right to protect themselves appropriately. 2 years ago, if you walked into a movie theater and the ticket taker was wearing gloves and a mask, you'd say, what, are they crazy? But it ain't 2 years ago anymore. And vaccines are out there. A lot of people are vaccinated, but they still want that extra layer of protection. And I think for a long time going forward, I think employers are going to have to not put their judgment on what they think an employee should do to protect themselves, but allow the employee to say, I'm the person who's most responsible for my own health, and I think I should wear a mask, and I should have hand sanitizer next to me. Maybe it will upset one person in line, but the vast majority will accept that, and that's what it takes to keep me here and working. First of all, when's the last time anybody on this phone call had a cold? There was no flu this year. People didn't get colds. It turns out that when you do these things, you actually are healthier. no, masks do not give you infections and cause autoimmune problems and all that other crazy stuff. They are a personal tool to protect yourself. And I think employers are going to have to be a little more lenient with that. And actually, some people are more put off by somebody not wearing a mask, but we have to let people make that decision for themselves too. That maybe maybe they got vaccinated, maybe they didn't, but I'm vaccinated and I'm taking care of myself. And that's how we're going to have to move forward with each other in a trusting way.
Victoria, I have a question really for not the participants, but the people on the call. We were chatting before we actually started, and we all, as healthcare providers, really the majority of the people that are in our employ have been vaccinated. I mean, we're looking at 90% plus. Are any of the employers out there concerned because they've got large numbers of people unvaccinated? I would be curious to hear from the people on the call whether that is an issue for them, because again, that gets back to what we talked about earlier. We may need to do better outreach and better education on the vaccine. I mean, we're all assuming everybody's at 90% vaccination rates because that's what we do, and our employees all are scientific and they understand science. But do we really know what the employer groups in this chamber or any of the chambers, what their rates are?
That hasn't been discussed. I don't know, Michelle, if you want to answer that, or any other business on here is welcome to either unmute or comment. I saw Renee just commented. We only have a handful of people that will not get vaccinated. So there's the answer on that one.
Okay.
I'm going to jump in on that. And I think that the frustrating answer to some of that is oftentimes the answer is it depends. And it seems as though specifically our manufacturers, many of our manufacturers work very hard to make sure that their employees were vaccinated. And in some cases, because they knew they had environments where they couldn't necessarily social distance the way that they really wanted to or needed to as effectively as they probably should have. So I know many of our manufacturers made that concerted effort, and you're probably looking at a solid 80-85% vaccination rate in most of those environments. Some of the other environments, then it really gets into that it depends environment. Some of our smaller businesses, they are pretty much relied on employees finding it on their own. So in those situations, I think that the vaccination rate is much smaller, especially in some smaller offices. Did find, however, that a lot of our professional offices as well had someone in the office who was willing to step up and try to help other employees get vaccinated. So I think in many cases, and that's somewhat probably indicative of the question that we received, that a lot of people are more comfortable at their work environment than they are necessarily potentially out in the public. And the other side of that is that the people who are working with the public are worried about the risk that the public brings into their office, I think is probably where those two pieces are. So, again, a lot of the bigger organizations, I think that we're seeing good rates. And I know that we've worked, similar to Victoria with some of our local pharmacies, they've gone right in, they've gone right to the employer and have done clinics for them right on site.
Mm-hmm.
One thing I'll add about the employers and vaccination rates is, in addition to my responsibilities at Geisinger, I also have oversight of the Pittston Vaccination Clinic at Centerpoint, which has been open for a few months now. And what I will notice is that it's great to actually hear people's stories as to why they come in to get vaccinated. And we ask them when they come in, why did you decide to get vaccinated now? And, a month or two ago, it was the elderly population wanting to see their grandkids, great heartwarming stories. And now we've actually pivoted to, especially with the masking mandate being lifted, is I want to be able to go into work every day and feel safe. And I want to be able to do my best at my job every day and not have that reservation every day. So I think those are the stories that if we can convince people to tell those stories at work, they'll be able to convince their coworkers to get vaccinated. So I think that's important.
Mm-hmm.
Let me flip the question then. So as healthcare providers, as of now, May 27th, where would you like, or where would you think we should be in society as far as percentages? I know we're not going to be 100% yet, but where do you foresee us being, or should we be, that you think would be a safe percentage, basically, at these businesses? Is there a goal number or percentage that you were looking at? I don't even know that question.
Victoria, you're
Really
cutting.
couldn't hear the question.
Yeah,
I'm sorry.
Oh, no, you
I
couldn't?
was cutting out. I couldn't hear what you were saying.
I'm sorry. So as healthcare providers, is there a goal percentage, I should say, that you were looking to be at in your, healthcare? I don't know if there's a goal number that you were looking to, for us as, employees, employers, businesses to be at. Hopefully you can still hear me. Love technology.
I think the CDC continues to reiterate, we want to shoot for 70%. When we hit 70%, you have the comfort of herd immunity kicking in, which will definitely decrease the spread among those who are not comfortable, that 30% who are still not comfortable to get vaccinated. And not to change the subject, but I think one of our largest barriers, and this is not me as a physician, this is me as a mother with a 7 and 11-year-old. I know most of my children's friends and the parents are not comfortable. They don't trust the vaccine in themselves or their children. They think it's going to affect their children's fertility when they choose to get married and have, their own families. And I think that's going to be a huge barrier, reaching out to the school districts and school-age children to encourage vaccination in that population. Right now, I think the older population has been adequately vaccinated. I think we really need to focus on the younger individuals.
Erin, that's an excellent point. I can tell you anecdotally, I just looked at our vaccine list of employees. We have 150 employees. The only non-vaccinated employees are young women, all nurses of childbearing age,
Yes.
who are afraid of fertility issues. That's it. There's
Yes.
5. That's it. There no other, and that is the reason. So, and again, I don't know, that's anecdotal. I mean, that's Deltamatics, but that is, and I'm not sure. I mean, maybe you or Pat can address it as clinicians. I'm just not sure. And that's one of those, as an employer, I wouldn't push that. As an employer, we are well within our rights to mandate that people have the vaccine because they're exposed to the public. And according to employment law, we are within our rights to mandate it. However, when you look at that group, I'm not sure you want to mandate that. Just throwing it out there.
Well, just to be clear, and I don't think anyone's going to contradict me, there is no effect on fertility. Absolutely, positively.
Right.
This
Right.
has been debunked over and over and over again.
Right, but perception is reality, Pat. That's
To
the
the
problem.
point that when the other side of that coin is the only connection between conceiving, vaccines, and COVID is that there is an increased rate in miscarriage in young women who get infected with COVID early on in their pregnancy. So it's actually 100% the opposite. If you are concerned about fertility, getting a COVID vaccine is the best thing you can do to protect your future pregnancies as well as yourself, because there is an increased rate of miscarriage if you are infected with COVID, and there is no effect on fertility. But that has been a persistent one that's hard to get rid of. I think because in the past, people are so hesitant to talk about vaccines in pregnant women or to talk about those things. Every study has shown it is safe in pregnant women. And as far as fertility goes, you're better off with it than without.
Actually, we have found the same thing with our employees, that our biggest population of employees that have chosen not to get the vaccine is women of childbearing age. A lot within our nursing area, that just happens to be where we have the most women of childbearing age. And what we've decided to do is actually do a very targeted webinar series for our employees, specifically around fertility and the myth and the COVID vaccine. And we're actually holding that next week for our employees. We're going to record it. We're going to offer it to people who, if they're not available to join us live. but we're really just trying to target, you know, what are the obstacles and the barriers that certain employees have to obtaining the vaccine. And we're just going to provide the education, because I think that's the most important thing. And if we provide the education, we have more people out there that know the truth and then can explain that to more people. So it's kind of, you know, we're going to build that army of education.
Stephanie, if there's any way you can pair with one of the local news stations to offer that to the general public, you know, if it rolls out well within your system, I think there's a lot of opportunity there to really facilitate the spreading of education to this group of individuals who are still uncomfortable and they buy into the fallacies about the vaccine.
Yeah, so we're going to report it. It probably is something that we may be able to offer to the chambers to have them available. So we'll certainly look into that. We have a fertility specialist and an OBGYN that's going to be joining, and I'll be moderating the session for them.
That's excellent.
Mm-hmm.
Hopefully y'all can still hear me. I'm trying to fix my microphone, but any questions out there? I know we're kind of coming to the end of our discussion, so feel free to ask now. We have such great panelists and they've been so gracious on giving us their advice. I'd love to see some more questions come out, or if any of you have anything to add that you want us to take back to our members.
I have something to add. So I'm sure everybody notices there's a bunch of different healthcare organizations on the call today. And we've said this from the very beginning, the right vaccine to get is whatever one is available to you at the time. We're not in competition for patients to get vaccine from any of us. We want just patients to get vaccines. So no matter where they're getting their vaccine, that's what's most important. If they go to a school, if they go to Commonwealth, if they go to Geisinger, if they go to Delta Medix, if they go to their pediatrics office when they're available to offer the vaccines, we just want to make sure that people get the vaccines. And we know that there's a lot of vaccine out there. Walgreens has them, CVS has them, Rite Aid. So, you know, you could utilize that state Department of Health website that has a mapping list of where providers are that have vaccine. I'm sure that we could work with the chamber to make sure that we have lists available also of places that people can get access to the vaccine. But really, that's probably a message that we would all want to convey, is that nobody's in competition for vaccine distribution. We just want to get everyone vaccinated because it benefits all of us.
That's a great point. Thank you so much. I do have a question. Is there any concern with the women of childbearing age about the vaccine and how it will affect their children if the mom is vaccinated?
So, and I'll let others jump in on that too. The short answer to that question is no. Probably no, with a bunch of periods after it. Expanding on it a little bit is people should understand the vaccines that are out there right now do not have COVID virus in them. Yes, especially after the second shot, some people can run a fever and get some symptoms. They are not carrying the virus. It at no time produces a virus in your body. You cannot get COVID from the vaccine, nor can you give it to anybody else. It basically produces a tiny piece of what the virus would be, that it's so that your body recognizes it later on. There is no virus. You can't give it to yourself. You can't give it to your children. There have been some small studies to show that, like a lot of other antibodies, that pregnant women who have gotten the vaccine, they've actually had antibodies found in their children, which is a good thing. They have found that there are antibodies in breast milk to COVID, which is a good thing. So the only thing that can happen to a mother or a father as far as affecting their children is that you won't bring the disease into your house, your kids won't get it, and maybe they'll even get a little boost in their immunity out of you, but you can't give it to them.
You know, I'm going to back that up. I am unaware of any birth defects at this time documented in medical literature related to vaccination of the mother. I am unaware. Not to say it doesn't exist, but I've yet to come across them, and I try to stay up to date on this on a regular basis.
And the American College of Obstetricians, one of the most conservative groups on the face of the earth with pregnant women is now recommending the vaccine also. So there has just been no connection with that at all. And again, on the other side, there is an absolute connection to early loss of pregnancy in women who do get COVID.
So there's no concern for birth defects due to the mom getting the vaccine. Hope we answered that question. We have another one. Another obstacle to vaccination is the allergic reaction based on allergies or reaction to other vaccines. Can you guys comment on that one too?
As Dr. Conboy had alluded to, messenger RNA works nothing like previous vaccines. I mean, the most common allergic reaction, influenza, and they use egg to make the vaccine. People who have egg allergy can frequently develop an allergic reaction to the influenza vaccine. And there's alternative forms of flu vaccine, so you don't have to necessarily take that one. We've vaccinated thousands of people up to this point. I can tell you the only allergic reaction I have seen, and we've come across reviewing charts, very mild erythema at the site that goes away within a day or two without requiring any significant medical intervention. I have not come across any major allergic reactions in the medical literature. I have not come across any major adverse effects documented in proper medical literature. I have read a multitude of adverse events on social media that hold no bearing in science, with no accurate literature to back up these statements. I think it's relatively safe. I don't know if anyone wants to add to that.
Yeah, we have basically seen the same thing at Geisinger. One thing that our patients have commented on is, if they have the allergy to that one specific component of the vaccine that is different than other vaccines.
Okay.
Yes. And what we've said is talk to your allergist. So it's also possible that you could speak to your allergist and you can actually see whether or not your allergy is severe enough that you need to avoid this vaccine. We've had people go to the allergist for this too, and that's what we'd recommend.
The only thing, and we have also given thousands of vaccines, the only thing that our medical people are saying is we've had a few people with Guillain-Barré who the outcome or the onset was after a vaccine. They basically referred people back to their neurologist to decide whether with their neurologist or their primary care physician, whether they should have the vaccine. And in many cases, neurologists were fine with it and it worked out fine. So again, anecdotally, we have had people that have had a prior history with a Guillain-Barré syndrome based on a prior vaccination who have done fine with this vaccine.
And we know we've been really safe. We've been extra safe with this vaccine, obviously, because it was an emergency use authorization vaccine. We had, if you had any kind of a shellfish allergy, a food allergy, a medicine allergy, you waited for 30 minutes rather than the typical 15 for everyone else. But we've already started to see FDA change some of those rulings. For the first 5 months of giving out this vaccine, we waited to make sure that you didn't have any other inoculation 14 days before or 14 days after this. And they've already rescinded that recommendation. So I think that probably in the coming months, we will continue to see the recommendations change, probably loosen up even more. And obviously once it goes officially FDA approved.
Thank you so much. Any other questions? And I want to just go back to Erin had mentioned our block party at the beginning of this month. We, still followed CDC guidelines, as you saw. People just want to get back out into society. It didn't matter that it was cold and rainy. They just wanted to get back out and be with other people. So I think that this has been great to just get a snapshot of what it's like now and what to look forward to, going back with society, back to work. I do agree with mental health too. I think people, I know Dr. Conaboy mentioned easing back into society. And I think, I hope that we're ready for that. And I agree with, staying safe. And, Stephanie had mentioned, looking at other people and keeping yourself healthy and, keeping others healthy. And I think hopefully we're getting there. Anything that we missed or that anybody wants to bring up before we conclude today? I know Margot wants to go to the beach, so she's ready to. I didn't pick on you at all during this call, but we all know most of you. We know where you are. I just want to thank you all so much. I think that this has been fantastic. And again, Stephanie, anything or Dr. Conaboy, anything or Erin, Margot, anything that we can help, and Michelle mentioned, anything that we can help, with you and educating and anything at all, please let us know. We'd love to help.
Thank you.
Thank you so much.
Thank you, Victoria.
Oh, thanks so much. I hope everyone has a great day. And hopefully we can keep the discussions going and the information flowing out to everybody and back to your doctor's visits and your screenings and back to work. So thank you all so much and have a great day.
Thank you, Victoria. Thanks for including us.
Thank you.
Bye, everyone.
Bye.